In the United States, 9 out of 10 prescriptions filled are for generic drugs. Increasing the availability of generic drugs helps to create competition in the marketplace, which can help make treatment more affordable for many people. Kai sat down with Partners in Primary Care for what you need to consider when talking with your doctor about your medications.
You've seen her on the show before. We love to have her on. Dr. Tracy Wakefield with Partners in Primary Care. Dr. Wakefield, thanks for coming back.
Great to be here.
Important topic, prescription drugs and generic prescriptions. A lot of people go, why are they cheaper? Shouldn't they be the same, or what? What's the deal?
Well, a lot of it is when these products that are originally branded go off patent. Other companies are able to, produce them cheaper, and they didn't put necessarily the research and development that often the companies are, recouping with the higher price. So yes, generic drugs, after the patent goes off for the original product, are cheaper.
But what makes them different?
So they really have the same, active ingredient or the important part of the ingredient, but so there's rarely a big difference between the brand name and the generic drug.
Now, when a doctor writes a prescription for a patient and it says the brand name, do they always get the brand name?
No, often if they do not check the dispense as written checkbox on a prescription label, the pharmacist is free to dispense actually the generic alternative if there is one. So it's really meant to drive, cost-effective care for patients in general, overall. So yes, unless your provider has checked specifically that dispense is written, you're able to get the generic substitution for that drug.
And would someone ask their provider to give them the generic, or why would a provider give them the brand name instead of a generic?
It doesn't happen very often, but there may be some perceived difference between the brand name and the generic. But like I said, it's few and far between where that actually happens anymore.
How would a patient find out if a brand name medication they're taking is available in a generic?
Yeah, I would just encourage them to ask their pharmacist, or even their provider will know.
And here at Partners in Primary Care, a part of the care team, you have a pharmacist.
Absolutely.
Here on staff.
That clinical pharmacist, like we mentioned, is meant to really make sure patients are optimizing not only their formulary on their drug plan, but also, making sure they're on medications that effectively and efficiently treat the conditions that they have.
Because whether it's generic or brand name, prescription management is something seniors deal with and get in trouble with if they're not making sure that
it's all working together, and absolutely,
Mm-hmm.
and they're really on the medications that their conditions call for, and provide the best care for a given condition.
And that oversight here at Partners in Primary Care is so helpful, I'm sure.
Absolutely, not only helpful for our patients, but also helpful for our providers to really stay on top of all the medications a patient's taking.
And when it comes to insurance, Medicare, they usually favor the generic, right?
Right. For most insurance plans, the preferred generic actually will carry even a $0 copay, because they're really trying to, emphasize the need to have really cost-effective care. And we know that these generic medications, equally treat the same conditions that the brand name, so that patients can get them at a much lower cost. So we really want to incentivize that behavior, and that happens to, happen with a $0 copay or a very low copay versus the brand name medication.
So people shouldn't worry if they get a generic drug.
No, I think it's important for you to really optimize, the amount of money you're spending on your medications, and you're still getting the same benefit.
Absolutely. Dr. Tracy Wakefield with Partners in Primary Care, thank you so much.
Thank you for having me.